Hey, my name is Victoria Crawford. I'm going to be administering medication by mouth to my patient today. All right. Water for my patient, Atenol, Tylenol, and furosemide. Okay. So I'm going to check my MAR with my healthcare provider's orders. I'm going to make sure they match. My client's name, Corey Griffin, date of birth 3/21/90, 3/21/90, MAR number 1234, MAR 1234. Perfect, and it does say no known allergies. However, I will ask when I get to the bedside. Okay, and I'm looking, Antinolol 50 milligrams versus my 20 milligrams. Acetaminophen 650, just Tylenol. Okay, we're gonna start with Antinolol. We want 50 milligrams. I'm checking it. Okay. All right, and in my room, or in the cart, medication cart, we do have Antinolol 50 milligrams, so I will not have to do any calculations, and I can just give one tablet. All right, I'm gonna wash my hands before touching the medication, if I happen to. Just give one tablet. Okay. And I check my expiration date, and it is intact. I'm gonna check this expiration. Okay, perfect. And this expiration date. Okay, and none of them are expired. So, Atenol, it is a antihypertensive medication. It's classed as a beta blocker. It's going to selectively block beta adrenergic receptors, decrease cardiac output and cardiac oxygen consumption, and depress renin secretion. For my patient, I'm going to check for allergies, heart rate, and we'll monitor his BP, preferably just before next dose to evaluate effectiveness. I'm also going to monitor hemodialysis patients because of the hypotension risk. So there's that. My next one that I'll be administering is furosemide, 20 milligrams. All right, so I'm going to do my check. Furosemide. This has 10 milligrams, so I'm going to give 2 of these tablets to equal the 20 milligram dosage that my doctor has ordered. So I'm looking, checking it, 10 milligrams. Check it, they want 20 milligrams, okay. So we give 2 tablets. Perfect. Okay. All right, and what furosemide does, it's an antihypertensive medication. It's classed as a loop diuretic. It's going to inhibit sodium and chloride reabsorption at the proximal and distal tubules and the ascending loop of Henle. It's used to reduce extra fluid in the body caused by conditions such as heart failure, liver disease, and kidney disease. This can lessen symptoms such as shortness of breath and swellings in arm, legs, and abdomen. I'm going to monitor BP and pulse before and after administration. I'm going to monitor his electrolytes, renal functions, and hepatic functions, serum glucose, and uric acid levels before and periodically throughout therapy. I'm also going to check lab values for sodium and potassium, and that is for my furosemide. Next, I have my Tylenol. It's also known as acetaminophen. So it requires 650 milligrams. So I'm checking acetaminophen, Tylenol. We actually have 325 milligrams. I'm gonna check over here, and it's requesting 650. So I'm gonna have to give 2 of these tablets to equal what the doctor has provided. I'm gonna check it here one more time. Perfect. Okay. So I'm gonna need to give 2. Good. Okay, and what Tylenol does, it's a analgesics It's a para-amniophenol derivative. It's going to produce analgesia by inhibiting prostaglandin and other substances that sensitize pain receptors. The drug, Tylenol, may relieve fever through central action in the hypothalamic heat regulating center. I'm going to check for liver function. I'm going to check and see if my patient happens to be pregnant. I'm going to check for allergies, check to see what over-the-counter drugs my patient's using. I'm going to consider reducing total daily dose and increasing dosage intervals in patients with hepatic or renal impairment. All right, so I have my drugs ready. I've checked them twice. I'm going to check them when I get to the bedside, but I am ready to go to the bed now. All right, I'm walking in my room. I'm going to wash my hands. Check my doctor's orders. I'm going to provide privacy. I am going to ask my patient, can you state your name and your date of birth for me?
Corey Griffin, 3/21/90.
Okay, let's see. And that matches, okay. All right, sir, do you have any allergies?
No, I do not.
No, okay. All right, and so my name is Victoria. I'm your student nurse. I'm going to be administering your medications today. Are you familiar what you're taking?
Yes.
Let's just go over a little. So we have Antinolol. It's your antihypertensive medication, your beta blocker. Are you familiar with that?
Mm-hmm.
Okay. All right. So Antinolol. Let me check it one more time. Perfect. Okay. Okay. Here's some water for you. And here is your Antinolol. It's 1 pill. Good. Okay. All right. What I have next is your furosemide, and this is your antihypertensive medication. This is just going to reduce your swelling in your legs. Are you familiar with your? Okay. So I do know that you may be used to taking just 1 pill. Because we do take 20 milligrams. However, this is going to be 2, just to, because we do have 10 milligrams, so we're just going to get to 20, okay? So it's 2 pills. Perfect. Okay. All right. Next, I have your Tylenol. And so are you familiar with Tylenol, sir? Okay.
Mm-hmm.
All right. So I'm going to check it one more time. Good. Okay. All right. Do you have any questions for me today?
Mm-mm.
I'm going to wash my hands. I am going to report any abnormalities that I may find. I'm going to document. I know my patient is sitting up right now. If he wanted to lay down, I would put him in a low lock position, side rails up ×2, and I am going to have the call light near his reach. I'm also documenting his notes, going to report any abnormalities, and I'm going to dispose of any biohazardous material that I may find. But I am going to go ahead and document. So are you okay with that medication that I have just administered to you?
Yes.
Okay. Do you need anything? Any more water?
No, thank you.
No. Okay. I'm going to go ahead and... You doing okay today?
Mm-hmm.
You in any pain?
No.
No. Okay. Alrighty. Well, if you need anything, you just let me know. I'm gonna wash my hands before I leave, and I will be back to check on you. Okay?
Okay.